You're listening to Be Health Connected, a podcast by the Gateway Business Health Coalition. Your host for today's episode is Laurel Pickering, BHC President and CEO.
Hello, I am Laurel Pickering, President and CEO of the BHC, and welcome back to BHC's Be Health Connected podcast. Today, I am thrilled to be joined by Dr. Shah, Executive Vice President and Chief Medical Officer at Twin Health. Dr. Shah holds an MD from New Jersey Medical School and her Master's in Public Policy from the University of Chicago. With a background in healthcare and healthcare IT, she is dedicated to driving equitable value-based care models that prioritize inclusion and accessibility. Now, in her role as CMO at Twin Health, she works at the intersection of metabolic health, leveraging innovative approaches to improve health outcomes and foster well-being. Dr. Shah, we're really excited to have you join us today. Some of the members listening may and should recognize the name Twin Health because we had you participate in our innovation forum, which was in February. We invited some of our members to be part of a dinner with Twin Health. So I'm hoping that Twin Health is becoming a known organization and a known company within our membership. But for those that don't know Twin Health and haven't been to our programs and heard what you do, can you briefly explain what Twin Health does and the role that metabolic health plays in overall employee health?
Sure, and thank you so much for having me, Laurel. It's such a pleasure to be with you today, and I'm so glad that we are able to talk about this today. So, just to get started, metabolic health really does directly impact employee health. We know that poor metabolic health, which we define as having cardiovascular illness, hypertension, abnormal blood pressure, high blood sugar, and abnormal, or what I like to say, unhealthy weight, leads to an increase in costs. Metabolic health is foundational, therefore, to employee health and wellness, to productivity, to people coming to work every day, and to people living long, healthy lives where they can contribute to their employers and their professional growth. Twin uses the first AI digital twin technology for human metabolism. That's our name, Twin Health, and it comes from digital twin technology. Digital twin technology has been around for decades in other industries. I like to usually use the example of aerospace or aviation, where it creates a replica in the cloud of very complex systems like jet engines or self-driving cars. Similarly, we are the first company to use that same technology and build a replica of a very complex system, human metabolism, and be able to predict how things are going to happen, bad things that could happen, and prevent them from happening in the first place. In the example of human metabolism, that could be even the smallest things like a spike in blood sugar, an increase in blood pressure, or a pound a week of weight gain. Okay. It also can mean higher inflammation in the blood vessels, higher fat around the organs, and insulin resistance. These are the things that we don't see that are happening inside the body and creating the clinical conditions we do see, like heart attacks and strokes and kidney disease. So when we use this AI digital twin platform, it delivers personalized behavior and lifestyle guidance in multiple areas to our members. Now, let's talk about what I mean by that. A lot of solutions out there are really looking at maybe just food or just medications or just activity. Twin is actually looking at your entire behavioral lifestyle and helping individuals understand what actually matters most for their health in that moment, on that particular day, real time. And those are across things like medications, but also activity, nutrition, sleep, and stress. And when we're able to use this model to give people daily feedback that's actionable, employees don't only just manage and reverse these chronic conditions, but they report out better energy, better sleep, and improved overall well-being.
So it's a really comprehensive approach, which I think is the point. Why does a twin health need to exist? When I think about a lot of what you're talking about, I think, isn't primary care doing this? Aren't physicians doing this where employees are getting care and should be helping employees manage chronic conditions? So why do we need a twin health to help us with metabolic health and to have an impact on what you just talked about?
Yes, it's a great question. And I want to start by saying I'm an internal medicine physician. I believe in primary care. I am primary care. I think it is so critical to our world that we live in and has a really important role. Obviously, we still have to do prevention and screening and take care of people when they're acutely ill and when they're in the hospital. But when you think about metabolic health and you think about these conditions, we'll talk about diabetes, obesity, and hypertension, most care and the time when it's identified begins too late. Okay. By the time a primary care physician notices it or sees it in a patient, it is usually because it came through blood work or they went to a visit and they had a blood pressure screening. And so people are treated very much episodically and briefly. They leave the office and then they're kind of left on their own devices to sort of figure out how to make that better. And when you think about that, for years I was taking care of people with diabetes. And I remember, or obesity, or all these conditions we're talking about. And I remember my frustration that my toolbox was I had 10 minutes and I had a lot of data in arrears. And what I mean by that is blood work that really represented today, but didn't really tell me anything about the last 90 days or 180 days for this person. I didn't know what they were eating, I didn't know their stress. And in that 10 minutes, when I had to send them on their way, I would say, eat better, sleep more, stress less, work out more, go to the gym. Oh, and here's a medicine. And I think that's not a fault or a failure of primary care. It's the way our system is in the United States and frankly, in the world. We are busy, we're taking care of a lot of people, and we have very limited time and frankly, very little data to be able to give people real-time accountability in their health. And that's actually what it requires to fix this trajectory of chronic metabolic disease that the United States is on right now, that is worsening and growing every year. We were built really to support. I always like to say to my primary care colleagues, we are the metabolic health consult on your shoulder. We are there to support the primary care provider, intervene earlier in real time, give people immediate feedback when they sit down to dinner at McDonald's, when they sit behind their desk and don't move for 10 hours, and remind them of the little things they can do that could have massive impact on their health so that when they go to their primary care doctor, they're really having conversations about prevention and not about how to treat something that is already too late.
I think we don't train primary care physicians to manage metabolic health. I have my own personal experience of great relationship with the primary care physician, got my blood work done, a little bit of high cholesterol, a little bit high blood pressure, and my PCP wanted to put me on medication. And of course, I said, oh no, I'm going to fix this on my own with diet and exercise. And he basically said, like, well, good luck with that. And we'll make an appointment in 6 months to see how you did. That was it. Like, he had nothing to offer me in terms of tools, resources, a recommended diet. It was just, well, okay, good luck. And I'll see you in 6 months and we'll reevaluate. So I understand, how that happens in primary care and why, there could be such a need for a tool and a solution like Twin Health.
Yes, and I think we have to remember we're really treating in primary care to the masses. What Twin Health is able to do is instead of saying, okay, I have to do the most generic solution that's going to catch everyone, which typically is medication, we're able to say, I can deliver an N of one hyper personalized experience just for you that follows you throughout your day and gives you recommendations that are so specific to you. And that is because of our sensor technology, our digital twin technology, and our care team we are able to really discern what matters for you, Laurel, versus, someone else, maybe even someone else living in your own house. And that is, I think, really powerful and just not where traditional primary care medicine has gone.
For this conversation, I wanted to focus on cardiovascular disease. At the BHC, we're working to educate employers about the impact, on their employees and then in turn on their workforce and their healthcare costs and help them with strategies to address it. Can you talk about how closely connected are metabolic conditions like diabetes, obesity, and hypertension to cardiovascular disease risk?
Absolutely. And I think, a lot of times we think about, well, cardiovascular disease is one of the biggest sources of morbidity and mortality in the United States, right? And globally. And often we think about the heart attack. That is sort of where most of our heads go when we think of
Yeah.
cardiovascular disease. And what's important to realize is that getting to that heart attack is the end state. The damage started decades earlier. And that damage actually starts before diabetes and obesity and hypertension. Those are the precursors to the heart attack. What actually happens first, and I always love to explain this to a lot of our members, if you really look inside the body, when you're young and you're 10, 11 years old, you can eat whatever you want. And you're also very active. You have a lot of energy. You don't have to sit behind a computer and work. You get to go to gym class every day. It's sort of just part of your right as a young child. And your cells are growing. And when your cells and body are growing, you're in a high metabolic state. Metabolism, and we often say, oh, my metabolism slowed down, right? Laurel, this is what we're talking about. When you're young, your heart rate is higher. 100 heart rate in an adult scares people. 100 heart rate in a kid is completely normal. So you're growing and you're in a growing metabolic state. As you age and become an adult, that slows down. Your heart rate slows down. Your cells don't grow as fast. They stop growing, or you don't grow tall anymore. And you actually get a real job and you're sitting either behind a desk or you're working a night shift. Whatever it is, life isn't like when you were a child. And so you eat things that are easy, and the damage starts to happen inside your body, and you don't see it. And the three things that are happening are insulin resistance, visceral fat deposition around your organs, and inflammation in your blood vessels. We don't see these things until we become either someone living with diabetes or obese, or now your pant size is going up. And it's very slow, kind of indolent process that starts to happen. When that happens, that is the beginning of cardiovascular disease because that insulin resistance and that visceral fat around the organs leads to basically an inflammatory reaction in your blood vessels. And those inflammatory reactions can create over time clots and blockages that lead to strokes, that lead to heart attacks, and that lead to organ disease and organ failure like kidney disease. So cardiovascular disease, the end state that we talk about, starts all the way earlier with these three disruptors that are happening inside someone's body that they cannot see. And that disruption sure is somewhat genetic, right? If you have a family history, you're more likely to become insulin resistant. But if you are someone whose lifestyle is also more sedentary, or you can't afford to eat at certain restaurants, or you're feeding five mouths, you're very stressed, you're not sleeping because you have a newborn, these things slowly begin to create an impact on your metabolic health that is not easily reversible without the guidance of your digital twin or something like digital twin technology and twin health. That poor metabolic health then accelerates the damage to your blood vessels and results in high blood pressure, diabetes, and obesity, where your body just stops working the way it was. Now, the good news is it's actually reversible. The bad news is we treat it today with medication. And often those medications just lead to a further and further long-term impact. They're not actually fixing that root cause. They're not reversing insulin resistance. They're not getting visceral fat off your body and reversing that inflammatory state. And so, if you can actually change that through behavior change and lifestyle changes, even the smallest ones, you can change the trajectory and reverse that damage. And I often tell people the number one risk to having a heart attack is living with hypertension. And so, it's very, very important to take seriously your blood pressure. And this is one of the reasons why Twin Health gives all of our members who are living with hypertension a blood pressure cuff. And then we sync that data into our system and we can continuously monitor it rather than them waiting to go to their doctor once a year and have it checked.
I want to dive into a couple things that you said there, Dr. Shaw. From a clinical perspective, why do you think cardiovascular disease continues to be such a persistent problem, especially in the working age populations? And you talked about, I might have a newborn, I'm stressed. I might also still be working and have a job. And, are there other things that contribute to the continued prevalence that we have of cardiovascular disease?
It's a great question, and it's obviously very complex. There's a few things that drive this. So first is most of us, when we're busy working and we're in that prime of our life, and I really think that that sandwich generation, you're taking care of your parents, you're taking care of your children, you're working, you're thinking about how to have enough for retirement, how to support your family. Guess who comes last? Me, us, right? Each person is not thinking about themselves. And if you're not having an acute pain or something that really feels off, people don't seek care.
Right.
And metabolic disease is silent, right? And gaining a little weight, we can always make an excuse for, oh, I just haven't eaten well this time, or I just had a child, or there's always a reason. Some people just believe it's normal. Look, I watched my own mother gain weight over the years. As I get older, metabolism slows down, I'm going to get heavier and I'm going to become obese. And that's just the way it has to be. So I think there's an education and a problem with how we have educated individuals to seek care and understand prevention of disease. So first and foremost, I think we as a country have not done a fantastic job there. The second problem, I think, is healthcare itself is access, low right now in this country. Many people do not even have a primary care doctor. They don't know how to access one. They don't live in a place where it's readily available. And when they try, the appointments are a month, 2 months out. Most of us can't even figure out our schedule for next week, let alone a month or 2 months out. And a lot of our population who are working age, things are coming up and they cancel and they cancel. And so they're not actually getting care when they need it. By the time they finally get in, it is too late. Okay. And then I'd say the third thing is that the treatments we have are too generic. If it's preventable, then we have to treat with prevention. But you don't ever see anyone get a prescription to go to a gym. You, you don't see people get a prescription to go eat healthy green salads. They get a prescription for medicine. And that is so much easier than trying to change your lifestyle, right? It is so much easier to take a pill or an injection and to manage the symptoms. Oh, yeah, I was really tired the other day. The doctor says, well, it's because your sugar was high. Oh, great, I'll take insulin. Now my sugar will go lower and I'll be less tired. And that tells me I'm okay. But what people don't realize is insulin causes weight gain. It worsens insulin resistance. And so this whole cycle I was telling you about just continues to get bigger and bigger. So we're using medications because we're really just trying to get a number down. We're treating a number. We're treating a symptom, but we're not treating a whole person. And if you don't treat a whole person, then you really struggle to address the underlying metabolic dysfunction that got them there in the first place. So that's why I think it's a persistent problem. We have to change our solutions and we have to put them in the hands of people where they are, not wait for them to seek care to get them.
You talked about education and prevention and that we haven't done a good job of that. And when I think about employers, I think about this is a place where they can shine. They have almost like a captive audience where they are educating about a lot of things, and most of our members are very focused on prevention. Can you talk about what employers can do around education, prevention, and investing in metabolic health?
Absolutely. I think employers play a critical role. I have really just been amazed and incredibly amazed by how employers are approaching the metabolic health conundrum today. In all of these conversations I'm having, they care. And they really care about the wellness and well-being of their employees. But they've been failed by a lot of traditional solutions, right? Point solutions, things that are just fixing the blood sugar, but not fixing the weight, not fixing the hypertension. So I think there's an opportunity now to really ask yourself as an employer, how do I proactively reduce chronic diseases by going beyond traditional point solutions, episodic care models, and really creating a culture and an environment that allows people to be empowered and accountable for their own health? So how can you do that? Well, you really have to find solutions that support people clinically and with data. Because one of the problems we have in healthcare is that most people don't even understand their own health. And if you don't understand your own health, you don't really know what to do about it. If you can find solutions that put data real time into the hands of individuals, you will be so surprised at how quickly they understand. Wow, I ate that and my blood sugar went up. Now I know that that is not good for me. But wow, I ate this and it didn't. But it did for my friend who also has high blood sugar. We're different. And you start to understand that your health is uniquely you. And there are things that are uniquely you that you can do about it. Giving that empowerment to employees is really, really important, and investing in, solutions that normalize and encourage healthy behaviors and help people learn from their own data, invest in education and data that will drive people to real-time action, make health very personal, make it about the individual, and support her whole person care. I think when you can find solutions that check that list, but also really bring clinical care, clinicians, care teams, not just digital solutions, but solutions that have mastered digital with human empathy and human touch, and obviously human clinical knowledge. I think those two together can be incredibly powerful for both educating and promoting a culture of prevention. And I think that's really what employers need to look at, as well as cost, right? So, really understanding the solutions that are going to impact your cost in a way that's meaningful and sustainable, not solutions that are going to get you 3 months of improvements and then people can't sustain those efforts and they end up just falling off. And I think those are the things that I would say that employers should really be thinking about through benefits design, as well as culture and education.
You said a magic word, data. We've been doing a lot at BHC to help employers understand their data. We have a new offering for our members. But the data you're talking about are personal health metrics. Can you talk about what kind of metrics Twin Health is tracking and why that visibility into those numbers is so important for actual behavior change? Like, what about the numbers and seeing them do you think influences someone doing something differently?
It's fantastic. Well, you can't measure data, then you can't actually see what's happening to you. So we use a few things. We have been very fortunate to have a explosion in wearable sensors in the US globally right now.
Yes,
And
yes.
Twin really takes advantage of those. We do not make our own. We are not a ring company or a watch company. We take advantage of all of those amazing sensors and we use them to create that blueprint of human metabolism because it all starts with biology, what is happening in your body. Okay. So the sensors we use, I'll first start by describing them and I'll kind of bring it to life. So the first one is we want to see blood sugar. Every participant in our program gets a continuous glucose monitor, okay, and it keeps them on multiple continuous glucose monitors to watch their blood sugar, okay, and they can see what makes it go down, what makes it go up. But it's not enough because what's really interesting is What makes your blood sugar go up and down is not just what you eat. So they do track for us their meals, and we give them feedback on the foods they ate. But the other thing that makes blood sugar change is activity. So going for a walk versus running on a treadmill can make some people have completely different responses because it's all about how fast your heart rate goes. Okay. So we also use activity trackers. All of our members get an activity tracker, but we're also compatible with the ones that they wear. So if they want to use their Apple Watch or their Fitbit or their Oura Ring, we can be compatible with all of those. Okay. So they use that data on our end. We can see their movement, we can see their activity, we know when they're working out, and we can watch now their sugar in context of their activity. But what we also get through those trackers are stress and sleep. And so I can see how when I personally, Laurel, if I sleep less than 6 hours a night, my blood sugar is 15 points higher the whole next day.
Oh, interesting.
Right? Whereas
Yeah.
some people aren't impacted by sleep at all. They're really fortunate. I'm not one of them. And if I'm stressed, I can see a spike in my sugar. So what we're able to do is say, well, look, it's great if you can wear a blood sugar monitor and watch that. And it's great if you can wear a watch, but how do the two talk to each other? That's what is going wrong with wearables today. You can't integrate them all. So you might be wearing a watch and you can see what's happening there, but do you really know if it's the thing that's impacting your sugar? If something else isn't analyzing all of this and putting it to you in a way that you can actually understand, wow, your sugar spiked not because you ate Chipotle, but because you slept 5 hours last night. The third thing we give members is a weight scale, a body scale. And it's not just any scale. We are actually measuring muscle mass and visceral fat. So it's a body composition scale. And what we really want to do is have people not just focus on the number, but focus on building muscle. With some of the medications that are out there now, and GLP-1s are one example, people are losing muscle. And muscle cells metabolize 10 times faster than fat cells. And so, if we want our metabolism to pick up, we need to be building muscle. So, we also measure that and help people see how they're building their muscle. And then finally, we give people a blood pressure cuff. So, we can track how your blood pressure improves as you improve your muscle and your heart rate recovery and your activity, and your steps go up and your sugar comes down, your blood pressure gets better. Okay. And we can track all of that in one place and really learn for each person back to, it's about each individual and what matters to them, which input, whether it's sleep or food or activity, matters most in that moment. And then use that to help people make better decisions. So, for example, if I'm wearing all these things and I decide to go to Chipotle, but today I walk to pick it up and tomorrow I sit at my desk, I will have a completely different glucose reaction. And that is power, knowing that. It might mean that I take that umbrella and I walk in the rain because it means I can have that Chipotle bowl because it totally changes how I metabolize that meal just because I walked there and back.
So you did talk about weight loss medication. So Twin Health does not necessarily, the program is not initially designed to provide GLP-1s or incorporate GLP-1s and weight loss medications. Can you talk a little bit about the thinking around that? I think employers are looking for solutions that are not driven by GLP-1s and weight loss medication. And I'd love to hear your thoughts about that.
Really important. So, first and foremost, Twin really is, I'll go back to where we started. We are solving the root cause. We are solving insulin resistance, visceral fat, and inflammation in the body, and that entire cascade of events that leads to cardiovascular events. That's what we are fixing. Medications don't do that. Our belief on medications is that they are not for everyone and they're not forever. I love to say that because I think some people want to use them for a little bit, but most people I've interacted with in my career as a physician want a chance at getting off of medicine. Not only are they expensive, but who enjoys taking an injection? And for employers, these costs are growing and growing every year. These drugs are expensive. If you could have an opportunity to be medication free, reverse that damage, and be without disease at a lower healthcare cost, everyone wins. And that's really what Twin is trying to achieve and is having good luck achieving, as evidenced by our randomized control trial with the Cleveland Clinic, which was a very important article for us that we can talk about in terms of our ability to impact health. So we are truly a clinical service that is healing how people's insulin resistance and all of these things happening in their body are progressing. So that being said, what about GLP-1s? Well, we really believe they have a time and place for people. But for Twin, our goal is to, even if we are using them, find a way to get people free of them and without medication long term, and help our partners to decrease costs and sustain those cost savings so that they can reinvest in their employees in other ways. And that's really how we think about it. There are a lot of organizations out there who are about prescribing them. Our belief is we prescribe them when appropriate and necessary, and we support people on them, but we always want to get our members to a place of better health that is medication free. And that is the Twin way.
Dr. Shah, this conversation has been very enlightening, especially when we think about cardiovascular disease. So for my last question, for employers who may think that cardiovascular disease is more of a retirement age issue or not as much as a working population issue, what would you say to help reframe that thinking?
It's just simply not true. Cardiovascular disease starts in your 20s for most people. And the sudden heart attacks that are unexpected are happening younger and younger, 40s, 50s. And these are not only catastrophic events for people and their families, but they're catastrophic from a cost perspective too. And it's our job as a society to prevent those diseases and to help people be more educated, more aware, and more proactive about how they can live a life free of them. And the thing that I really want to remind everyone of is that by the time the heart attack happens, it's already too late. People are feeling badly for years before that. They're not productive at work. They're sleepy. They're tired. Insulin resistance, metabolic damage, and disruption is all happening inside their body, and it's going unaddressed. And so, yes, it's about preventing that heart attack, but it's also about giving people more productive, more energetic, and honestly happier years, especially during, as we were talking about early, those working age sandwich years, which are really challenging and really hard. And I think this is the way we can do that. So we shouldn't think about it as a disease that happens when the event happens. It's a disease that's happening and it's ticking. And every year I hear more and more stories and see more and more patients who are struggling and don't even realize it. And I think it's our job as a healthcare society to help address that early and quickly and proactively.
Well, I hope this conversation inspires employers to tackle cardiovascular disease head on. We have some tools on our website, on the BHC website. We have a cardiovascular disease toolkit that we would love for the members to look at and take advantage of. Thank you so much, Dr. Shah, for joining me today. And thank you for listening to Be Health Connected, empowering healthy workforces one conversation at a time.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the Gateway Business Health Coalition, please visit www.gatewaybhc.org.